So today is our final webinar, uh, which is sort of available for everyone. It's good to see we have a lot of familiar names, and we're just going to be going over motivation for medicine today again. So it's me and Sam. My name's Ashir. Sam, do you want to introduce yourself really quickly, if that's okay for anyone new?
Yeah, of course. Hi everyone. Hopefully most of you remember me. So yeah, I'm Sam, one of the senior tutors with the company, and I'm a final year medical student at Birmingham.
Yeah, brilliant. Yeah, so we'll get started if that's fine. I'm just going to share my screen, Sam. I've got a QR code for any new students, anyone who's new and hasn't attended one of the webinars before. We've got a WhatsApp group chat where we basically every week sort of announce new webinars, or we give you sort of tips and advice on your interviews. We also give you a little bit of ideas about what to do for your application this year. So we have Q&As on Sundays, for example. It'd be great if you guys can join this. Um, but yeah, no pressure if you do not want to either. So I'm just going to share the screen. You can grab your phone and just scan this QR code and join on WhatsApp if you'd like. But yeah, so today we'll be spending an hour talking about sort of motivation for medicine, the key sort of elements for what's positive about medicine, what's negative about it. We might do a bit of practice as well. We touched on it last time, last week briefly, Sam, I think.
Yeah.
Today we're just sort of expanding on the same points and sort of delving into a few more facets about why people want to do medicine. So we'll get started. Somebody said that they missed the last week's lessons. Is there a recording available? There certainly is. So if you search up Medic Mind on YouTube, you will find the recording. It's under the live sessions area, so you should be able to see that. Okay, so we'll get started. Right. So Sam, do you want to talk a little bit about to the students about what sort of the pros and cons of medicine are, if that's okay?
Yeah. Okay. So pros and cons of medicine. I mean, we all know a lot of the pros. So let's start with the cons of medicine, as these are sort of typically a bit harder to answer if the interviewer asks you a little bit about what cons are you aware of in medicine, or what downsides are you aware of. So the main cons about medicine are, first of all, the work-life balance compared to most other courses and most other jobs that you could do. Medicine is going to demand quite a lot more of your time, quite a lot more of your energy. Now, how could you balance that? You can always say, well, I've always enjoyed working hard, my passions. I've always enjoyed applying myself rigorously to whatever I do. But it is a con to be aware of, and it's certainly something that is probably good to discuss. Another potential con is that you're under a lot of scrutiny in medicine. So, as both a medical student and as a doctor, you're going to be constantly monitored by seniors and by managers and by groups like the GMC to ensure that you are adhering to practice. So it's quite a lot of pressure. And obviously, that's not the only source of pressure as well. You're going to be expected to be at the top of your game by patients as well. And a third and final con of medicine, I would say, let's have a think. Probably nowadays, another con of medicine is probably the pay, not quite what it used to be. And obviously, there's a lot of strikes going on regarding this. Whilst I wouldn't say it's a con compared to a lot of other potential careers you could do, it is worth saying nowadays in most interviews that you could go for something that makes more money potentially. So a degree like economics or maths. And that's probably a good thing to acknowledge because they are if you say in the pros section that money is one of the pros of medicine, they might raise an eyebrow, and that's not really what they want to hear from you in terms of the pros. Ashir, would you like to talk a bit about the pros?
Yeah, absolutely. Just one thing before we move on to the pros as well, Sam. I think it's quite important when we're talking about the cons as well, that when we discuss these cons, we want to really focus in on why that's not going to deter you from medicine necessarily. So, for example, we said the money aspect, which I think is something I bring up last personally. But if you were to bring it up and you were asked about it, like why would why would you not want to do medicine because of the money? You could talk a little bit about that money is not the important factor. So turn it into a bit of a positive area as well. Say
Mm,
money is one side and any career should be rewarded. But however, money is not the main motivating factor to me. And stick by your guns for what your motivating factors are. Everybody's going to have different um, reasons of why they want to do medicine. Some people like the dynamic nature of medicine, how it changes every so often. There's new research and new guidelines implemented. Some people prefer being a leader and making key decisions for patients. You can emphasize that. It's really turning that negative into a positive. So if you don't like, if they bring up the idea about long working hours and burnout rates, you could talk about the importance of work-life balance and how you practice that. So they show you want to show awareness that you have an idea about the cons, but you know how to circumnavigate them as well. And the positives, that goes into the positives really. So there's quite a few positives to medicine. I know that it's been getting a lot of negatives in the news recently. But if you go back to basics about medicine, the main things that medicine is renowned for is number one, you are highly competent and highly trained. It is a quite satisfying feeling to have that diverse knowledge to an extent where you can impact somebody's life in often quite a huge way. So, for example, um, medicine is not just being a clinician. You can go into research later on. You can go into teaching, so you can pass on that knowledge to other people. That knowledge is something, I'm sure Sam agrees with me, but at medical school, I have to learn topics at least 3 or 4 times before it sticks with me long term. And often you will forget things very quickly. But once you learn it, you often are able to become a very adept problem solver. And that has quite a nice feeling to it. It's hard to describe, but once you understand certain complex terminology, complex guidelines, and diagnostic factors, once you understand pathophysiology of certain diseases, you're able to recognize it much better in practice. And that's something that does motivate some people. So when you're highly skilled and you have lots of knowledge, that's a motivating factor. The other thing as well, another positive is very few careers. So I think Sam mentioned a bit about, for example, banking or economics. You will often have similar to what's a desk job. You'll be sitting behind a desk. You may not have that much interaction with people, and often not in ways that makes a huge impact straight away. If you are, somebody said they can't see the screen. Can you see the screen now? Sam, are you able to see it?
The screen is there, yeah.
Yeah. Okay, that's fine. Great. So if if you think about what you're doing in medicine, you aren't directly always saving lives all the time. You are contributing to that, however. If you're a junior doctor who's just seen a patient come in with acute exacerbation of COPD and A&E, and you follow the ABCDE approach, you stabilize them a bit, there is a bit of satisfaction with that. And it's quite prominent in the first few days. You do feel it a lot more. And people do get they feel rewarded by that. And that's one thing you can focus on, the rewarding nature of the career. You don't tend to get that with lots of other careers. When you see patients turn around from a very critical condition to being stabilized and being quite happy, you see the family's reaction to that, it can be quite satisfying as a job. And that often keeps people motivated to keep going on. So you can focus on those areas as well. I know somebody said, oh no, sorry, not somebody, so Sam said that pay is one factor, but the other thing as well is that I would probably, for every one of you, just not touch on that unless they ask you. Medicine is still overall, compared to a lot of other careers, as you specialize and get more sort of they say experience, you will get higher pay. And compared to other careers as well, it does get up and up and up. Obviously, I do agree with Sam here that it's not paid as much as it should be, and a lot of people agree with that. But try not to mention this. I think I was asked in a couple of interviews, but I never really brought it up directly unless I was prompted. What about you, Sam?
I think it was only one of my interviews that asked me about it. But I think so for me, quite a lot of them sort of liked, as you say, Ashir, um, if you're going to talk about a con, it's good to try and say, well, this is a con in medicine, but for me, either it's not a con because you've turned it into a positive, or I'm aware of this con, but I've got strategies for managing it or getting past it or whatever. So yeah, I think Ashir gave quite a good point there. It's perfectly. I personally think it's absolutely fine to say, oh, the money in medicine's a bit controversial. You know, there's a lot of striking going on, and in other countries you can make more money. However, for me personally, I think there's more to a career than just money. And yeah, you can also chip in the fact that, as Ashir said, it's still relatively compared to a lot of other jobs in the United Kingdom, still pretty well paid.
Yeah.
So yeah, it's okay to mention cons, but definitely give us an idea of why you're going to get around it and why that's not going to stop you from dropping out.
Precisely. That's the number one thing. So when Sam said dropping out, that's the number one thing they're trying to filter out. They don't want somebody to join the course and then just leave suddenly because they've realized in first year this is not for them. They spend an
Yeah,
awful lot of money. I know that we pay
yeah,
tuition fees around £9,000. It's increasing, but they also have to pay a certain amount of money, the government does. So if a student drops out halfway through, it doesn't make sense for them economically, and it also isn't that it's a lost opportunity for somebody else. So just to
absolutely.
summarize, here are the main 5 points. To help patients, you want to elaborate on this as much as possible, well respected, but you want to talk about this in a way that sort of it gives you gratitude to be in a career like that. Academic challenges, like I said, some people prefer learning things and putting themselves into an area where they're well specialized. A variety of career paths. So, like I said, you're a teacher, you can be a manager, you can also be so a clinician, researcher, all of the different things. You have a lot of responsibilities. You tend to have clinical responsibilities and also outside of there as well. When you're a doctor, you generally are not just working in hospital. You have lots of other things you're doing as well most of the time. And again, with the cons, it's stressful though. There's a lot of pressure. It's often rude patients at times because they're often quite stressed out about their situation. And there's a lot of time constraints, particularly in A&E and GP, for example, and you are held to a high degree of public scrutiny. So if you make one small mistake, it can lead to huge issues. Okay, so there are quite a few different types of specialties in medicine, and it does take a little bit of time to understand for students who may not have too much knowledge at this stage. Sam, should we introduce a little bit about what the differences are between these 3 different types of doctors I've put on the slides here?
Yeah, why not?
Yeah.
So we've three sort of big groups there. So GPs, these are the ones you guys probably, I would guess, may have probably the most experience with. These are the doctors that you've probably seen the most, both as patients potentially, but also potentially work experience. I think GPs tend to give quite a lot of work experience. So your GPs are your generalists, as it says in the name. They are in public practices, so not in hospitals normally. They have their own practices and they are generalists. The idea is they see people in the community who have arrived, and basically it's up to them to decide, is this something that we can treat in the community, or is this something that we need to send people to hospital for? Or maybe it's so minor that you can just deal with it yourself at home. Maybe it's just a cold. That's the main role of the GP. Then in hospitals, we have hospital doctors and surgeons. Now, I think what they mean by hospital doctors is medics, medic doctors. And medic doctors are mainly primarily concerned with physiology. So they are dealing with sort of body systems and trying to influence the physiology that is going on in that patient. So this normally means that they're dealing with drugs that can influence the patient's physiological system. So they're very much thinking about, hormones, cells, those kind of things. Surgeons, meanwhile, tend to be more physically manipulating parts of a patient's body. So this involves normally cutting up the patient, maneuvering bits and pieces around to reach the desired effect, whether that's cutting out a tumor or putting two bones together, or maybe it's a plastic surgery operation and it's for purely aesthetics. But so surgeons normally physically hands-on maneuvering body tissue. Medical doctors, or hospital doctors as they're calling them here, is dealing with using drugs to try and influence a patient's physiology. And then GPs are the generalists who are sort of filtering out who needs to be treated in the community versus who needs to go to hospital, and then who can just stay at home and get better by themselves. That would be how I would probably sum up these 3 main specialties. Within each one, there are lots of subspecialties. So surgeons, for example, you've got trauma and orthopedics, you've got urology, you've got neurosurgery. So there's lots of different types of surgery. Hospital doctors is more or less everything else. So anything, most things that don't have surgery in their name. there are a couple of exceptions like urology, but most of them, if in doubt, are going to be medical specialties. So you've got rheumatology, dermatology, respiratory, gastro, neurology. So a lot of those. And then GPs, there are some subspecialties of GP, but I don't think they would really expect you to know. GPs in general are generalists, hence they don't specialize as much. But quite often in a GP, you'll have a particular GP in each in each practice that might have a specialty. For example, you might meet a GP who's taken an extra course in psychiatry or something. But in general, GPs are their own specialty, and that's the only one of these three that doesn't have its own subspecialties. Yeah, that's a pretty quick rundown of these three types of specialties.
Yeah. The important thing to understand is that they all have similar types of skills that you require. There are variations, however. Um, but like Sam said, it's important to understand the differences. We put hospital doctor here, but we tend to say internal medicine. They are, we would think of like you said, Sam said, rheumatologist, dermatology, cardiology, endocrinology, they're all typical kind of doctors you would see in a hospital. There's trained to a different degree as well, and there's different training routes. We won't be going into that today. In future webinars, we will give you a bit of an idea about what you need to sort of do to train to become those kind of doctors. There's different training sort of pathways for every single specialty in the UK, as well as if you go abroad, then there'll be different pathways as well. But anyways, we won't go into that too much. Just out of interest, in the chat, is there anybody at the moment that has sort of decided what they want to do? This will probably change when you go to medical school. If somebody says GP, emergency medicine, dermatology, surgeon, cardiologist, surgeon, dermatology, pathology. Okay. There's quite a lot of variation over here, which is good to see. When I was in school, every one of my friends and me just wanted to become a surgeon. And then I kind of changed my mind midway through. How about you, Sam?
Well, I mean, I always find it. I think it actually, as people start medical school, because it's quite typical. And yeah, as you say, surgery is a very typical one that everyone goes for because it sounds impressive. But I think it's very interesting. We've got it's so nice to see such a range. But I think for most of you guys at your age, it's very, very difficult to know. You might have seen a specialty or two on work experience that you found very interesting. But be very flexible and open-minded. In fact, as I went through medical school, I got less and less certain, and now there's still good handful of both medical and surgical specialties that I could well see myself doing this time in 5, 10 years for sure. So be very open-minded is what I'll say. And yes, as we're about to talk about with this question, that is one of the first things they'll see, they'll want from you is but you can always say whichever specialty you want to go for, but do acknowledge the fact that you've got very limited clinical experience at this stage in your career and that you're very open to changing your mind, experiencing different specialties and seeing what catches your interest. They're looking for open-mindedness here for sure.
Yeah. Hey, Sam, somebody has asked a very interesting question. Which category does psychiatrist go to? I personally put those under internal medicine, but however,
well, I think
psychiatry seems like it's a completely different subspecialty.
It is a different one, I would say, yeah. I think as well, it's a very good point to raise. So, I mean, we're trying to simplify it because there's, I mean, God knows how many specialties. There's 20, 30 plus. There are loads of specialties you can pick, and each one has different routes. And then within psychiatry, for example, there's subspecialties such as CAMS, which is Child and Adolescent Mental Health Services. So that's the specialty within psychiatry looking at children and adolescents. We tried to group them into those three main ones, but I agree. I think we should probably add psychiatry to that because it is quite its own thing and it's quite a big one as well. Ophthalmology as well. I see a lot of ophthalmology in the chat. Ophthalmology is an interesting one. It's it's not truly medical or truly surgical. It's actually somewhere in between. Ophthalmologists typically will do both will have clinics and they can offer medical therapy, so drugs, but there's also ophthalmological surgery, and they both fall into the same category of ophthalmology. So yeah, it's not a perfect sort of system that we created there, but we're just trying to simplify as much as possible so we don't need to go through all 30 specialties, I would say.
This is something you will expand on as you go through your career at medical school as well. But now it's a good idea to have a basic understanding different subspecialties. Somebody asked, could you show awareness in specializing within specialties such as cosmetic dermatology? It's absolutely fine to go into any, like Sam said, we should try and keep it a little bit general at the start. But if you
Mm,
have some key areas of interest, you could say that you are interested in certain areas and
mm,
certainly talk about what kind of, if you have done any type, some students have done a bit of research. I personally didn't before I went to medical school. If you have done research, attended conferences or anything, and you have a little bit of a portfolio going, you could talk a little bit about that. It's not a bad idea too. If they ask, what if you don't get into that specialty, they probably won't in an MMI, but in a panel, if you get asked, what if you don't get into that specialty, you need to show that you are well-rounded as an individual, that you will consider other opportunities as well.
I
Ideally,
think
they
the big thing
want
to
some.
bear
Yeah. Um,
big thing to bear in mind for that, guys, is there's no guarantee at this stage that you can become whatever you want to become. And as Ashir has said, you know, you've regardless if you want to be a dermatologist or whatever, you've still got to understand every other body system, and you've got to appreciate those people who do that. So yeah, I would say in general, if you've got a specialty in mind, that's good. Be careful if you start talking about subspecialties because it's very hard to make that decision. I would say at your age and stage.
exactly, and it is quite competitive, especially dermatology. So I personally would steer clear, but if you want to, that's absolutely fine. So we've got an answer here. Is this a good answer? I think we all probably agree it might not be the best. So it is a good starting point, however. On its own, it's not the best answer, I would say. What would you guys perhaps add to this if you can put in the chat? What would you perhaps add to maybe elaborate? Just some key bullet points, perhaps. So Habiba said it, I think it's showing lack of interest. If a student said this to me and I was the examiner and it was the only thing that they said, it probably would be a little bit of a disappointing answer. Um, Divit has said, mention potential areas of interest, but maybe clarify this could change over your time at medical school. That's a good point, yeah. Um, Somebody has said, I want to keep my options open, but I hold an interest in X, Y, Z because, yeah, that's a good starting point. So overall, Sam, I think we all agree it's not a really good answer. And I think a lot of the students have put in sort of how to elaborate on that. I think from the chat, you can see a lot of people have got the right idea. What do you think?
I completely agree. I mean, so in any question, this also applies particularly to ethics questions in an interview where they ask for your opinion. Try not to sit on the fence, I would say. Acknowledge, so if it's an ethics issue, for example, acknowledge the complexity, acknowledge that there's a lot of gray areas, and acknowledge that you could maybe be persuaded either way. But I would always say try and come down on the side because it makes it easier for us when we're examining you to say, right, this person's got an idea of pros and cons, they've got a position, they're showing awareness of both sides of the debate. And the same here. I think it's a good idea for you to say, I'm interested in dermatology, say. Maybe I'm interested in dermatology, specifically cosmetic dermatology, because I saw a clinic and I thought it was really cool. That's getting a bit niche now. But you say, oh, I did a bit of work experience in dermatology. I found that fascinating. However, I'm aware of my own limited clinical experience currently, and I'm sure there's lots of interesting specialties out there waiting for me to explore. I'm very open-minded, but dermatology is something that right now I am quite interested in. That's where we want to hit a bit of a balance between I like this specialty, but I'm open-minded. I completely agree with Shir. We want to give the examiner an idea that we're interested in something, that we've seen something.
Yeah, exactly. And that leads us on to our next point. So Sam has given a very good example of what you should say. What does everybody think about this answer over here, bearing in mind Sam's feedback as well? Can you leave your thoughts in the chat? Do you think this is a better answer? If so, why? Adam has said it seems good. I agree.
Niche, but better. I agree. I think this is definitely better because they're showing a lot of evidence here. HCGP is the Human Complete Genome Project.
Yeah.
So this person's actually done a bit of reading around this. They've done a little bit of thinking. They've also looked into the medical school and what they're offering in this particular field. I would say this is much better than the previous one, but if anything, remember as well, obviously you'll have a bit more time to answer than this. This person could then go on to say, however, I am open-minded, I'm aware. This one might be maybe a little too far in the opposite direction. We're very, very honed in on this one field of genetics. And again, I would be asking, well, have you seen X specialty, Y specialty, Z specialty? What do you think about A, B, C? If I had time as an examiner to this person.
Yeah.
So it's definitely better than the last one, but I think there's room for improvement.
Completely agree with Sam. And why we've got these in just short form over here is just to give you guys a bit of an idea of what kind of things you should be saying. Ideally, you want to expand and elaborate a little bit more. So one thing they've done really well over here is talked about the intercalation year over here as well. And that's a really good thing to show. It shows enthusiasm. It shows that you have knowledge about the medical school without them even asking. It shows that you have interest in specializing from now, but you're also very open-minded. So I think this is a much better response. You can still work on it though. We'll move on to the next bit. I think, just thinking, what's the best way to do this, Sam? Do you think we should ask the students what they think a GP does? Maybe pick on one student, maybe perhaps somebody who's had some work experience, be lucky enough to sit with the GP, what they think the GP, what happens in general practice. Is there any,
Yeah,
yeah, should we do that?
I think so. Yeah,
Yeah.
and whoever it is as well, ch extra challenge for you. What is the difference, as we've talked about this briefly, but what differs a GP? What extra duties or what fewer duties do they have compared to your hospital doctors as well?
Let's do that, yeah. So if there's anybody who's had work experience or has some knowledge about the GP, even if you haven't had work experience, do you want to raise your hands? So then we might pick on somebody just to give their own opinions about what GP does and the difference between other careers.
Is any part of this webinar appropriate for dental applicants?
We will talk
Th
about probably a bit
yeah,
about that towards the next few bits, if that's okay. Yeah. I think everyone's quite shy.
yeah. Oh, we have a
Oh,
hand.
we've got Christopher here. Perfect.
Hi.
Hi, Christopher. How are you doing?
I'm good. I'm good.
Right. Yeah. So tell us what do you think a GP does in their day-to-day life?
Yeah, so basically the role of a GP is to look after the general health and well-being of the patients in the local community. That means if a patient is concerned about their health, then the GP is their first port of call. And their GP, or their GP practice in general, will have um, lots of information about that patient on their records and provide a continuity of care for that patient. They are able to go through many basic procedures. They can do blood tests for the patient if they're concerned about any sort of symptoms that the patient has, and can refer them on to the hospital if they believe that um, there's something else so that they can't treat the same community and they need like more expert healers, or they can treat um any symptoms that patient has within the GP clinic a local
Mhm.
patient clinic maybe. And
Christopher, you're
yeah,
cutting out a little bit. Sam, can you hear Christopher okay?
Yeah, some of it, I must
A
admit,
little bit
it's not.
patchy. Is it okay if you
Yeah.
speak a little bit closer to
uh,
the mic? I've got some parts of what you were saying. So
okay.
if that's all right,
Can
Christopher.
you hear me now? Or
Yeah, I can hear you better. Yeah, it was a little bit muffled. I got some parts of what you were saying, but in short, you were talking about that they're community-based practice, and they will see more general sort of cases, the well-being of patients, and they'll know the patients a little bit better. Is that on the right lines of what you were saying? Yeah.
yeah, sorry you couldn't hear me.
No worries, no worries. Oh, yeah, but is that the right lines of what you were saying, Christopher?
Yeah, yeah.
Perfect.
I mean, gonna I can I had a bit of work experience as well. Had a GP practice.
So you've had
Um,
work experience as well over there, yeah?
yeah. And it showed me how GPs don't just they don't necessarily work in isolation, but they also have their own sort of multidisciplinary team. They work
Good.
with like in-house pharmacists and other healthcare professionals um, inside their own practice, and they have their own kind of multidisciplinary meetings to discuss like complex patients.
Perfect. So just for timing purposes, Christopher, I'm just going to cut you off there if that's fine. We got it right there. So most of the time, we call GPs as a gateway to medicine, basically. They're the sort of the key holders. Habiba, I'll come back to you in a moment. Thanks for raising your hand. I'm going to actually pick on you for the next bit, if that's fine. But you're bang on right. The whole point of GPs is basically to essentially, if we had all the specialties open and any patient could go and just see any specialty whenever they wanted, becomes quite a bit of a mess. GPs are really important to help make sure patients get to the right areas. And they often have a lot of knowledge about a lot of different things. And what they're doing is they're seeing patients in the community. They're not just there as a medical purposes, but they're there for the patient's well-being, mental, physical health. They're also there to monitor patients. GPs are an essential part of the community, and they, like you said, they work as with a multidisciplinary team. They have many other different community-based healthcare professionals that they work with, as well as with hospital medicine and surgeons as well. They'll always be communicating with those guys as well. But the whole point of GPs is to provide a point of contact for medicine. It's also to provide continuity of care, because once you're in hospital and you're treated and you go back home, you won't necessarily see the doctors you did in hospital. It's your GP who's then going to take care of that patient. So, for example, I know I brought up acute exacerbation of COPD earlier. Let's say somebody gets acutely unwell because they've got COPD, they get an infection, and they end up in hospital. When they recover and they've been treated in hospital, it's now up to the GP to think about what's the next steps for now treating this patient. They've had an exacerbation, they're continuously having exacerbations. Do I need to change the medications around? Do I need to introduce something else? Do I need to provide other sorts of management? This is something a GP will also think about. Obviously, the hospital doctors will contribute, and they will all GPs also have a really nice thing as well, that a lot of the times, if they are unsure about something, they can also contact hospital doctors that are on call and discuss different cases with them. So other than just community-based healthcare professionals, they've got access to people in hospital as well, that are the more specialized doctors, and they're constantly communicating with each other. So have you got anything else to add there, Sam? Just for timing purposes, I'm going to move on to the next thing, but really quickly, have you
No,
got?
I think that is it. I think that is more or less it.
Yeah. And this is if you were going to talk about being a GP, I know a few people said that. These are the main points. It's the variety of different cases you'll see. It's being within the community and being an integral part to it. And the fact that you're not just treating, like when you're a surgeon, you are mostly doing surgical management. But as a GP, you will not just treat the issue that's in front of you. Often when somebody presents with any sort of illness, they will have multiple different issues going on, not just their physical health, but it affects their mental health, it affects them financially, their jobs, it affects pretty much every aspect of their life. And the GP does have a role in that as well. Okay. So if you want to be a GP, these are all important things you want to bear in mind. It does say flexible hours here, but I'd probably say that's to a degree. In your entrepreneurial element, this can change depending on legislation, but you can become a GP partner, and you can set up your own practice. There are other subspecialties within being a GP as well, where you can perhaps have a bit more control over your schedule and perhaps your the entrepreneurial element as well. We won't go into that too much right now. I think Habiba had her hand up earlier. Habiba, do you still feel confident answering this one here? What does a hospital doctor do?
Well, first of all, can you hear me?
I can hear you fine. Yeah.
Okay. Actually, I think this question applies more to me. I had work experience in the endoscopy unit at a hospital as well as the OR. So I was very much hospital centered in my
Good.
work experience. So, I mean, from what I observed, I feel like the hospital doctor uh, is has some aspects that are common to what the GP does, in terms of, okay, they have been transferred from the GP and then they have the like their history and what the GP thinks the patient might have. And then they have to kind of build from there and figure out what they can do to treat the patient with the facilities that they have. But for me, I mostly observed when once the doctors have already made the decision and now they're just going in to operate. So I didn't really see the decision-making aspect as much. So yeah.
Okay. So did you see a lot of endoscopies and you observed and sat in theater with them? Is that right?
Yeah, exactly. And for me, that showed me how like one specialty can have a really broad amount of like um patients. Like for example, I never knew like the amount of things that an endoscopy could be used for. For example, there was like an esophageal dilation for older patients who had trouble maybe swallowing, but also the endoscopic unit really dealt with a lot of also like bile duct stone removals and things like that. So it was a very broad spectrum of things that I thought was fascinating.
Okay, very good. Gastroenterology is one of my favorite subjects at medical school, so that's good to hear that you got to see a lot of endoscopy. For anybody who doesn't know what endoscopy is, it's just basically when we're investigating the GI system, if they suspect any sort of illness over there, they will put a tube or a camera in. It's a long one that either goes in through your mouth or from behind, and it actually takes pictures of your GI tract, and you can visually see what's in there, and you can also administer different types of management. I won't go too much into that, but that's just for everyone's understanding there. So the GI problems are increasing in our community. You've probably heard a lot about it in the news. We're seeing a rise in colon cancer. We're also seeing a lot of people with, for example, iron deficiency anemia. Well, the main thing is like GI and colon cancer, which has been getting worse and worse in the entire community, and that's something which is growing in medicine. So, when we talk about these different things, you want to show a little bit of interest as well for like Habiba did there. Habiba, you said you didn't really see the decision-making aspect. What do you mean by that when you were in the hospital? What were you talking about sort of the management the doctors were doing? You didn't sit in with the MDT then, or what happened?
So for me, most of the appointments that I attended were ones that had already been previously scheduled based on a previous consultation on what the next steps will be. So I didn't see their thought process, like their initial thought process to do certain procedures. So that's just because of the circumstance of the day that I was in. So
Okay. That's absolutely fine. The main thing is, what did you learn from watching endoscopies? What was it that you saw that fascinated you about that career?
So like I mentioned earlier, the vast like spectrum of different uses in just of like the endoscopic procedures in just one specialty. So that really opened my eyes to that. Like I always thought endoscopies were very limited and not very fun, but I mean the variety for me is very important in the specialty that I would like to choose. So seeing that that can even happen in more specialties that I thought were boring, quote unquote, was very cool for me. And also in the OR, I actually find it quite cool that they were like I always like imagined the operations and stuff like that, but actually seeing it in person was like something totally different. And I also witnessed like different types of surgery. So there was also a laparoscopic surgery. So again, the variety was a really big thing for me in my placements.
Great, yeah. So one thing about hospital doctors is you can see it's a little bit of a different. Now, if we compare it to what we were talking about with GPs, in GP, you can't really do endoscopies. You could do minor procedures, but there are specialist equipment and you need to be trained doing endoscopy as well. So hospital doctors do, to become a GP, you can actually do F1, F2. I sometimes forget, Sam, but it's F1, F2, and then you do 3 years of GP training. Is that right?
I thought it was 5, but yes, I'm not. I must admit, I'm not looking at that, so I must admit, I'm also not
Yeah, I think it's about 3 years
specialized on that one.
training. I'm not looking at either, but if you check, it's less than surgery, for example, or to actually go to endoscopy, I believe it's a little bit longer. So you actually have to be trained properly for this. Essentially, there's an AI who's talking in the chat. Sorry, it just threw me off there, saying it's a bit quiet in here. I'll be leaving in a minute, but that's somebody's AI note taker. Anyways, yeah, so you have to train a little bit more because using specialist equipment, there are risks of, for example, perforations, etc., and you've got to be quite careful with it. So when we talk about hospital doctors, there's a degree of extra sort of specialization, and once you actually go into that grade, you'll mostly be seeing patients who are coming with conditions that require endoscopies. With general practice, you'll see other conditions as well, but when you're in GI and surgery, for example, you might not be seeing those kinds of cases. That's one main difference in hospital medicine. If you're a general internal medicine doctor for the first few years, you might be seeing all different types of cases. But if you're in gastroenterology, you'll mostly see gastroenterology cases over there. And that's one key thing. So you specialize and you gain a lot more understanding of that particular set of illnesses. The other thing as well about hospital doctors is that there often is the timing aspect. Like we talk about flexible hours when it comes to GPs, and you're more sort of community-based. So you sometimes what people like to think as 9 to 5 jobs, whereas hospital doctors don't generally work that way. Hospitals are 24/7. You will see wards open all the time. Doctors will be doing night shifts. There'll be doctors coming in very early in the morning. For surgery, you do have to come in very early in the morning. When you guys have surgical rotations in year 3, 4, 5, you will be woke. I used to go in like at 7 a.m. I'm not sure about you, Sam, but they do call us in early. And that's one of the key things about that it's quite stressful as well. And you do have often odd working hours as well as a hospital doctor. So just for timing purposes, again, these are the main things about hospital doctors, why you want to do just 3 main bullet points I'd put it down to. So you're a bit more specialized. There's more of an intellectual challenge with understanding certain conditions. When they say pathology-oriented approach, that means that mostly what you're doing is like, for example, the endoscopy. A lot of the times, if you suspect there's something malignant or a cancer, you do the endoscopy, maybe take a biopsy, send that off to the histopathology lab, and they will get back to you. So you're doing a bit more investigative work over here. GPs do some procedures, but a lot of the times they will not be doing things like a biopsy, for example. They might take basic bloods, etc., or ECG. But over here, you have a little bit more of a workup, and you're doing that in hospital. But again, this is all comes back into circles. You'll eventually end up back in the GP if you're treated well. Great. Anything to add to that, Sam, or should we move on to what surgeon does?
No, I think that was a pretty comprehensive overview of what medics get up to.
Perfect. But that, we probably, just for timing purposes, Sam, we will probably discuss what a surgeon does. I think this is something you mentioned you were quite interested in, surgery. So if I'm not wrong, I forget sometimes. But do you want to discuss a little bit about what a surgeon does, if that's all right?
Yeah, that's fine. So as I think I mentioned briefly, surgery is more about the sort of hands-on physical approach to trying manipulate body tissues to do whatever we want them to do. So as Ashir said, pathology, there's a sort of pathology-oriented approach in hospital medicine where we're dealing, so if we have a cancer, well, if they had a cancer, depending what it is, you might be able to use an endoscopy to do it, which is a sort of lighter surgical procedure that a medic could do. But if it's a large tumor, or depending on the location, it might not be possible to deal with it from a medical approach. You'd have to take them into surgery. You'd have to make an incision to remove the mass or the tumor. So medical in general, let's actually use the example of a cancer. Medics would be responsible for determining what is this cancer, what pathology does it follow? Can we give some medicines that will slow it down or maybe destroy it? So chemotherapy, radiotherapy, etc. Whilst the surgeon would be responsible for maybe removing it. So yeah, surgeons, as you can see from the picture, it's about the physical manipulation of body tissue. For that, most of the time, patients are going to be under general anesthetic, where they are asleep. For more minor procedures, they might be under local anesthetic, so they are conscious, but there is part of their body has been numbed, usually using a nerve block. And yeah, surgeons are normally responsible for potentially removing things physically, or maybe they might be responsible for sewing things together, making holes in things. So all the ectomies, otomies, etc., those suffixes have meanings. And then finally, they might do aesthetic procedures or grafting or transplants. There's lots of niche things that might do. But most of the time, surgeons, I think you can probably say, are either sticking things together. So that's normally fractured bones. Trauma and orthopedics is one of the biggest surgical specialties. Removing something. So this is normally like a colon cancer or a liver cancer or a lung cancer, or potentially something a bit more specialized like a transplant or a some sort of aesthetic procedure. That's what I would say most surgeons get up to.
Yeah, perfect. So I think that outlines pretty much what surgeons do. Again, if you are somebody who likes to come in early, please do surgery. I'm just kidding. Again, procedure oriented, immediate results. I mean, that's the aim. That is the aim of what you want. But you'll realize not every single case is clear cut like that. Diverse roles as well. Again, surgery has many different branches as well. You'll find out later on, but we won't go into that too much today. Right. So I don't think anybody has changed their mind after we've discussed a little bit about, unless you don't like GP anymore. But keep your minds open. That's what there's a main message from me and Sam. Try and make sure you look at medicine as a sort of a playground for the next 5 years or so first. And then once you have done all your rotations, you've learned a little bit more about them, you will eventually realize what you like and what you don't like. Okay? And that can change. It doesn't sound fun, but it is. But anyways, this is our last webinar where we will get to see so many of you, most likely. But after this, it is a paid set of webinars. So it's been a real pleasure, sort of hosting this to everyone. If you are interested to join us for the next few months, we do cover a lot of topics in different parts of the interviews. So, I know we've just done motivation for medicine and a bit of an introduction, but later on going to ethics, different hot topics, quite a few of the sort of niche kind of topics you can be asked about at med school. So if you are keen to join that, please do scan this QR code. When it comes to grad specific advice, now I haven't applied as a graduate, but from my understanding, Sam, somebody has asked any grad specific advice for interviews. I don't think there's a whole lot of difference between undergraduate and graduate. What do you think?
The main difference is in this section here, motivation for medicine. If you've graduated with a different degree, they're going to want to know why, A, you didn't go for medicine first of all, B, depending how long you've been out of university, what have you been doing during that time and why are you coming back now? Other than that, I agree. The ethics is going to be the same. The other, basically all the stations other than motivation for medicine and even a good amount of motivation for medicine is also going to be the same. The thing that I would definitely have a think about for if I were you is what degree did you do? How does it relate to medicine? Why did you do that degree instead of medicine? And finally, if you have done some work or something in between graduating and applying for medicine, why were you doing that work? What was the reason behind not applying for medicine immediately? I would say, other than that, very similar.
Yeah, I wouldn't get too bogged down about undergraduate versus graduate. People like to classify it in different ways, but for the most part, it's pretty much the exact same.
Yeah.
With that being said as well, I think, Sam, with motivation for medicine, it will vary for everyone anyways. Somebody on a gap year versus somebody who's in year 13, somebody who's maybe
definitely.
perhaps a mature student, it will vary. So that's just more an individual aspect. So as somebody has asked about the timetable, if you scan this QR code, it actually takes you to the web page where you can go ahead and see everything about the webinars. I've left a code there for you guys. Anybody who hasn't attended doesn't get the code, but this is available for you guys if you wish to just get 10% off. You can cancel at any time. So if you get your interviews and you manage to get your offers, you've done your, well, you won't hear back for your offers just yet, but if you manage to do all your interviews by December, you can just cancel. But that's for you guys there. We are just going to ask for a quick favor, very quick one. So I'm going to leave this bit if that's fine, because we're just running out of time. We want to get through Q&A as well. If you guys can just leave us a quick bit of feedback. Sam puts a lot of effort into these webinars, as do I, and we just appreciate the feedback over here for us. If you can leave a comment to say if you've done that, we will be giving one of the students, actually I think we'll give a couple of the students the webinars for free until February. So we'll just contact you via email because all of you registered for this and we have your emails on the registration form. So if you just go ahead and just say yes or something like that in the chat when you've done that. Meanwhile, whilst you guys are doing that, there was a couple of questions that caught my eye. There was one question about how would you structure your answers for ethical scenarios? This is something we'll be covering later on, but with ethical scenarios, it's very, very important that you take a holistic approach. They are not looking for an answer. You do not need to find the solution right away. They're more interested in finding students that are able to discuss the different aspects. Now, let's say, for example, I asked you about, for example, let's say I cheated on an exam and Sam caught me. For example, a hypothetical situation, that was a scenario. And then what would Sam do in that situation? Obviously, the obvious thing is that Sam would report me, but that's not the answer that they're looking for. They're looking for the pros and cons of the actions that you will take. So if Sam was to report me without speaking to me first, what would that do? Or if, for example, Sam came and spoke to me directly and asked what was the reason behind that, what kind of impact does that have? So you need to talk about every small thing, the positives and negatives of doing certain actions. Would you agree with that, Sam?
Absolutely. And the other thing I would say for almost every ethics scenario, especially healthcare-based ones, is use the pillars of medical ethics. Not only are you showing off your general ethical knowledge, but also it's a free template. You've got 4 points for free that you can discuss about in almost every single ethical issue within medicine. So it may be a bit harder to apply it to the scenario Ashir just gave there, which is a more sort of general, non-medical specific one. But they typically like to talk about things like, euthanasia or abortion or consent. Use those 4 pillars because they give you 3 points, is what I would say, and you get a show off that you've done a bit of extra reading at the same time. One of the questions that I saw was, with pathologists, are they hospital doctors? Because I thought they do lot more research and less patient contact. Yes, and then someone says they're normally based in a laboratory. Yes, so there's again sort of one of those specialties that falls a little bit outside of the sort of generalizations we were making for the sake of simplicity. But yes, pathology are technically hospital doctors or medics because they are dealing with sort of physiology and they're looking more at a cellular level and drugs and hormones and molecules rather than surgeons who are dealing with body tissue. But yes, they are definitely one of those. I mean, yeah, pathologists will very rarely interact with patients. You're absolutely right. They're one of those that falls a little bit outside of the standard group.
Yeah. Again, we did sort of an oversimplification of the specialization there, so it is a little bit more complex than that. And there is one in GP, I'm not sure if you know, Sam, one with public health interest, which has like a competition ratio. Yeah, that came out.
Yes, ridiculous, yes.
There are also subspecializations of GPs as well in like public health, etc. So it's a very, very, there's lots there. But the point is,
and a lot of the more niche ones also are changing all the time as well. That public health thing, as Shir just mentioned, is relatively new. That hasn't been around for that long.
Yeah, so you don't need to get too bogged down about that. Just understand the main differences. I would just put it down to like community, hospital, surgery. 3 main things.
Yeah.
Yeah, so what I'll do, by the way, the QR code is fixed for anyone. Somebody's asked what are the common diseases, illnesses we need to know about. To be very perfectly honest, you do not need to know them. I guess if you really want it to be safe, really want it to be safe, again, just make sure you're doing well at A-level biology. Anything that comes up on like diabetes, cardiovascular disease, that's the main stuff. You're not going to be asked about anything.
Yeah, absolutely. And I agree with Ashir. You don't need to know how it works or what the treatment is or the pathology. If it's something big and broad, or if it's something that you cover at A-level, definitely know it. But if it's something like as big and varied as cardiovascular disease, it's actually probably more important to know the public health implications of that rather than specific treatment or diagnosis. So why is it a problem? Why is it on the rise? What could we do about it? Who is this important for? Et cetera, et cetera.
Exactly. And Sam gave a really good point over here that right now that what if I have to give you the examiner's sort of perspective here is that they are not looking for something. Your grades are going to prove that you're academically studious. It's not your knowledge at the interview. That's not what they're assessing. What they're assessing over here is that you have good knowledge about other aspects of medicine. So, prevention strategies, primary, secondary, tertiary prevention. So read the news. Try and somebody asked as well, like, where should I get different information or case studies? BBC Healthcare is a really good one. The GMC website as well, with good medical practice. Try and understand other aspects of medicine as well. So not just the biomedical part. You do not need to know that. But yeah, if that makes sense. But yeah, I think we've got about 3 or 4 minutes left. If anybody's got any further questions, feel free to ask. We'll take one or
Will
two.
they ask?
Oh, sorry.
I see one. Sorry. Will they ask any detailed biology questions or math stuff at stations? Answer is, unless you're going for Oxbridge, almost certainly not. There are a couple of weird ones. So Birmingham's a bit of a weird one. Birmingham has 2 math stations. They're very easy maths. They're medically oriented maths as well, sort of like dosage, calculating doses and concentrations of drugs, that kind of thing. I would say, so long as you're secure at GCSE level maths, because that's what you're expected to have, A-level biology, A-level chemistry, so long as you don't even need to be at the top of your game, but just fairly secure in those fields, unless you're applying to Oxbridge, which is a different story, then you don't need that much. There won't be any detailed stuff on biology or maths beyond what you're expected to know already.
Yeah. I think even for the maths, you have to bear in mind not everybody's doing A-level maths. Most people will just leave it at GCSE. Actually, for you guys, it's changed, hasn't it? They all have to take A-level maths now.
Do they? I didn't know that.
I read it in the news somewhere. I might be wrong. Somebody could probably tell me better in the chat if that's the case, that everyone has to take A-level maths. But no, okay, that's just me reading.
Oh, that was the thing that was something they were going to bring in, but I think the Tories were going to bring it in, and then they just scrapped it. Yes.
Yeah. Anyways, yeah. If you run out of points,
is there a?
Sorry, we've got 2 different questions.
Sorry, I'm just reading questions. Sorry. Is that okay? Sorry. Is there a wrong answer or wrong side to taking an ethical question? I get asked this quite a lot by my pupils. I would say this. Just follow the British law. Why? So again, if it's something that there's a bit more laxity on, then you've got a bit more of an opinion. But let's say it's abortion, right? Abortion is legal in the United Kingdom. Why? You could you can make ethical arguments for it to be illegal, but why do that? I always say, if it's something like euthanasia, which is illegal in this country, or abortion, which is legal, wouldn't it be convenient if your opinion just happened to line up with what British law states, is what I say. Is it wrong to say the opposite? No, especially if you give a well-balanced answer and you admit the moral complexities and the moral gray areas, etc. Not necessarily a problem, but why make it more weird or more difficult? Just follow the British law is what I would typically say there.
Yeah, and again, do not, when Sam says that, it's very important you do not bring anything personal in. So if you disagree with abortion, for example, do not bring your personal opinion in. It's not designed for that. It's designed to see if you know the different aspects about why people would agree or why wouldn't. Try and detach yourself from that. I like to use the phrase, some people would think this about this situation, some people would think that. So rather than using I think this or I think that, think this is one side of the argument, keep it quite neutral. Try not to take a side. Even with euthanasia, for example, the moment you say, for example, I think euthanasia is perfectly fine, you're going to dig yourself a hole. If you say, for example, some people think euthanasia is fine and it should be allowed in certain circumstances, you can elaborate on that without actually bringing yourself into the spotlight. So that's a very important part about ethics. There's nothing wrong with right in ethics. The whole point of ethics is just basically to discuss, what is right or wrong. So this has been discussions for hundreds of years and nobody's got to the right point, and we constantly change our mindset on things. So, you're not expected to know the answer necessarily. But yeah.
Absolutely.
I think we'll sorry, we're going to answer another question, Sam, but just for timing purposes, if that's okay, we'll stop it there unless you want to answer that question. It's completely up to you.
Should we do one more?
We'll
Are
do
you
one
happy
more.
to
We'll
do
do the
one more?
last
We'll
one.
do.
Oh,
It
fine.
was just the one that caught my mind, so
Go
I
for it,
didn't
go for it.
realize the time. Do
Yeah.
they ask a lot of questions on personal statements? Is the last one. The short answer is no. Vast majority of places don't care anymore. In fact, they're planning on getting rid of personal statements. That is, UCAS are planning on getting rid of them because very few people read them anymore. Again, there are a handful of universities that may have one station on it. And again, Oxbridge, again, do occasionally have one panel interview where they will mention it briefly. But the answer is for most places, nothing will be from your personal statement because remember, your personal statement is personal. They'd have to personalize it to you. They don't have time to do that if they're seeing hundreds or thousands of you guys for an interview session. And if it's one of those rare universities that does use it, it'll be one station or a short part of a panel.
Yeah.
Cool. Thank you very much.
They're moving away from personal statements anyways.
Yeah.
Back when me and Sam applied, for example, it was a little bit more of an important factor, but now most universities, I think, are moving away from it.
Yeah.
So,
And even I don't know about you, Ashir, but even for me, I only had one. It was my
Yeah.
Oxford interview. It was the only place that asked me about personal statements. Nowhere else asked me at all.
I think it was perhaps that even for the admissions process, very few universities now take into account it. Yeah, it's been going down and down. So you're right, yeah. But anyways, it's been a pleasure, and thank you so much for today, guys, and thank you, Sam. Anybody who'll be here next week, we'll see you same time. Okay.
Yeah. Cool. Thank you, everybody. Have
Right.
a good rest of your weekend.
All right. Take care, everyone.